Let's react to this video by Tina Yong. It's called I Got Lip Liner Tattoo in Korea, Plump Lips Without Filler.
I flew all the way to Korea to get my lips tattooed. Yes, you heard that right. I'm getting a semi-permanent lip liner tattoo today, and I'm going to show you the entire process, how painful it is on a scale of 1 to 10, and share with you how much it cost.
Yeah, some people come in and they have just like a slight asymmetry on their lip and they wonder, is it worth doing surgery or some filler, or should I investigate something else? So this is that something else. Tattooing the lip, like a lip blush type of procedure. Let's see how her experience was.
I stumbled across this service on Instagram, and it seems that only in Korea offers this type of lip liner tattoo.
Yeah, that's not true. I mean, these are procedures that are offered all over the world. Korea does a lot of cosmetic work, so maybe it's offered there at a slightly higher frequency than it is in other places, but lip lining tattoo is something that's available in the States and in many other countries around the world.
I've been wanting to get it done for a while, but I've been pregnant. I gave birth, had a baby, and finally I can treat myself and do something for my lips. Now, I love the look of a fuller, youthful lip.
Just looking at Tina's lips, I mean, they're very nice. She has nice balance of volume between the upper lip and her bottom lip. And she overall has a bit of arching to her upper lip, but it's not anything that's overly pronounced. It's a very nice overall shape to her upper vermilion border. And when you look at her red lip all the way out to the oral commissure, you can still continue to see that red lip show. And that is a nice feature to have, because some people, as you get out to the side, the lip rolls in quite a bit. And I think that this type of feature with the lateral lip show is very nice and it complements her face well. So she does have a philtral distance that looks like a moderate length and overall has very nice lip anatomy. She also has very nice symmetry, both at the level of the cupid's bow as well as going out laterally too. But when you look at the lip volume, you can notice that the right side of her red lip is a bit fuller than the left side. And we all have some degree of asymmetry in our lips from one side to the other. That's very normal.
I did a bit of research and I kind of weighed up, should I get filler, should I get lip liner? And my decision at the end is to go with lip liner, because with lip filler, you gotta do it constantly and there's a lot of maintenance.
Yeah, you know, each of these modalities has its own pros and cons, right? Some people don't like that with a lip liner tattoo, it's very difficult to completely get rid of it. Even if you get laser removal of that pigment, it doesn't necessarily go away completely. Also, if you get lip filler, you know, and you don't get dissolving, then you can potentially have some migration. And as we talk about in many other videos, and really this has been the talk of a lot of content online over the last few years, that filler also is kind of a more permanent than we were originally told that it was, right? So that's something to keep in mind. But we do have dissolving agents for like HA filler called hyaluronidase, so that can surely help return things in part to how they were before the filler procedure. And then of course it's important to keep in mind lip lift surgery, whether it's a corner lip lift, a bullhorn style lip lift. I do a lot of that in my practice, and these are different types of procedures, and again, each can address certain features of the lips, and each has different goals, right? So if you're looking to shorten the philtral distance significantly, you can't really do that with filler or with lip liner. But if the philtral distance is not an issue for you, then you can surely consider these other less invasive modalities. But also, like, say you want to expose more of your upper teeth. Well, neither the filler nor the lip liner tattoo will be able to accomplish that, whereas a lip lift will, right? So it just depends on what you're going for. And I think it's always best to talk to someone who can offer all those different modalities, or at least refer you to the right place if they don't themselves do that type of treatment. But I think it's only fair for patients to give them the full range of what's possible and what might be best for them. Like, a lot of times I refer people out for a lip liner tattoo, even though that's not something we offer in-house. So I think it's important for patients to seek out the proper advice where it's a kind of a non-biased approach to giving recommendations.
Here's what my lips look like before. I like my overall lip shape, but I do feel like my lips are starting to thin out.
As we age, the roll of the lip, which is right at the vermilion border, oftentimes flattens out. So we lose some structure there, some integrity of the the tissues, right? As we reduce the collagen and elastin with the aging process. And that's partly what people notice. And sometimes a little bit of hydration from filler can bring that back. Other times, something like this with the tattoo can help. But remember that tattoo is not going to give any three-dimensionality. So it doesn't really bring back that role of the vermilion border. So that's something to keep in mind with the tattoo. But it can surely help with adjusting the shape of the vermilion border, as well as some symmetry enhancements if those are needed. And then of course color as well.
Also, I want to shorten the space between my nose and lips, which is called the philtrum.
Remember, one other way to do this with shortening the philtrum, if you're looking for a very modest change, would be with Botox. So you may have heard of lip flip, and that's the use of Botox, usually just a few units at a few key positions along the vermilion border, and that allows a very small amount of elevation of the vermilion. It's usually not a very significant change, maybe maximum like a millimeter of increase. With the tattooing, I think generally the cosmetic tattoos are not done to enhance the upper vermilion by more than 1 to 2 millimeters. But if you're looking for a more significant height increase of the lip and a reduction of the philtrum, that's when you can consider something like a lip lift, or the specific type of lip lift that I offer in my practice called the Ella lift.
When your philtrum is shorter, so the space between your nose and your lips, it's like closer, you tend to look a little bit younger, more youthful. So with lip liner tattoo, you can actually overdraw your Cupid's bow to make that space look shorter so you look younger.
It's kind of like what some people do with makeup, right? They overline the lip to make it look fuller, to make the distance look shorter. And that's something that the lip liner tattoo is essentially imitating.
As you guys know, I'm 35 this year, so I'm doing what I can to maintain my youthfulness and skin.
As an aside here, keep in mind that at feelconfident.com, we have an incredible HA serum. It has various hyaluronic acid molecular weights, which is important for both adding maximum hydration to the skin, but also being able to penetrate to deeper layers of the skin. So check out our HA serum. We've also done some clinical research on our HA serum. So make sure to check out that specific data so you can see how our HA serum performed, and hopefully you'll give it a try if you haven't tried it already.
When I was younger, I would just buy a lot of makeup, cover things up, get creative, and just sort of pack it on.
So the other thing in Tina's case is that she has nice upper tooth show when she opens her mouth and when she smiles. Not everyone has that. So the people who don't have that in a very evident way will sometimes consider the lip lift surgery because that helps expose the upper teeth more. But in Tina's case, since she already has the upper tooth show, she probably doesn't want or need to expose more of the upper teeth. So that's why I think for her to look into this lip liner tattoo makes a lot of sense, because a lip lift will shorten that philtral distance, but it will give her more tooth show, which might work against her aesthetic goals.
Speaking of maintaining youthfulness, I've recently partnered up with Amiro Beauty.
Well, she should be partnering up with Feel Confident. In addition to that HA serum, we also have a facial moisturizer, which has also undergone extensive clinical research. So please read the actual clinical results on our website. And then we also have a facial cleanser. These are custom formulations that I was a very big part of creating, along with our lead chemist who has 40 plus years of experience in the beauty industry. So please check it out. They're wonderful products. We've had awesome reviews over the past year plus that they've been out on the market, and we want to hear from you. We want to get more feedback on what you think of our products, and we keep innovating and doing, cool new things to try to improve hair care and skin care for everyone.
My lips are about to be improved. The artist Belle is working on me today. She starts by gently cleansing my lips before applying the numbing cream. Then she covers my lips and lets that sit.
So the covering of the lips with that numbing cream allows it to actually work in a stronger way. It will absorb more and will give her more anesthesia so that she feels the actual tattooing less. And so for like surgery, like our Ella lift lip lift, the difference there is that we actually inject local anesthesia. So like lidocaine, right? We inject it in, and then that provides more intense type of numbing and for a longer period of time because we're actually actually doing surgery. In this case, or for example, filler, you oftentimes don't need to inject the numbing, but it's nice to apply some on the skin surface. It has the same general agents like lidocaine or betacaine or tetracaine that will allow some degree of numbing to occur. And that, of course, makes the actual procedure more tolerable.
It did feel a little bit tingly, but not painful, just kind of a buzzy sensation.
And of course, like since it's right on the lips, like some of the stuff inevitably you'll actually lick and swallow, and so you might feel a little bit numb in the throat. So you don't want to be eating right after this. You want to let that numbness completely wear off before you ingest any food or have any drinks, because otherwise you could potentially aspirate some of that, meaning to have the food or the water go down the wrong pipe.
Next, she maps out the shape of my lips, overdrawing them slightly to even the edge out and give my lips a fuller look. I told her I mainly want to make my top lip a little bit bigger.
Yeah, like there's a lot of artistry that goes into this. Just like for the aesthetic surgeries that I do, it's a very artistic process, and so is something like this. So when you're picking someone to, whether it's for lip surgery or for this type of cosmetic tattooing, you have to really do your homework to pick who you believe to be a wonderful artist, not just a good technician. So that's important.
And for my bottom lip, to just give me a more defined shape.
So looking here, it looks like first she marked the midline, which is a good landmark. Then she did the actual columns, or around where the philtral columns would be. And then of course she marked out the neo-vermilion border and how she wants to increase the fullness on one side versus the other side. So as I look at the drawing, what I can see is that the right side is marked out a little bit fuller still than the left, because she starts off with the right side being a bit fuller, and then the markings are somewhat enhancing that side more than the left. So that's a little bit of asymmetry that will persist. And for the bottom lip, it looks like she more or less followed the contour of the red lip and its border. So I don't see too many differences there, but on the upper lip, they're trying to make these few adjustments. So we'll see how that turns out.
Once I'm happy with the outline, Belle mixes up the pigment so that it will match my natural lip color, and then we begin. She uses one of those sponge things that dentists use. You know those ones? I don't know what they're called, but I feel like Bugs Bunny with them in. Now, you're probably wondering, did it hurt? Well, my lips were numb, but I could still feel a little scratchy sensation. It's definitely not 100% painless. I'd give it a 3 out of 10 on the pain scale. Still very tolerable. The most sensitive part for me has to be around the Cupid's bow. Ooh, that was a little bit more prickly.
Yeah, when I'm doing surgery, that central area has generally more blood vessels and nerves there, so it's going to be a bit more sensitive. And the interesting thing is that when I do the hair surgeries that I'm known for as well, the central hairline is also going to be usually the most vascular and also the most challenging to numb. And so it's interesting that she feels a bit more centrally than she does laterally. That's something that we also experience in the hair work that we do, but it's also something visually when I'm doing the lip surgeries, I'm seeing those blood vessels, those nerves, and there's more of them right in the middle. And I think it's has something to do with like the watershed effect, meaning that the vasculature and the nerves generally come in from the sides, but then they cross around the central partition of our face. And so where that happens, where that central crossover occurs, you're essentially getting the nerves and the blood vessels coming in from both sides. And so I think that's why there's just a higher quantity of these structures in that central zone.
Here you can see Belle is shading in my new lip line and blending it downwards towards my natural lip. It didn't take her long to finish the first pass on half my lips, and here you can really see the difference.
And you can see that while the shade is close to her natural pink lip, it's not exactly the same. It's a little bit more orangey, a little bit more of like a brownish orangey coloration compared to her natural. And a lot of people would not be bothered by that. I know some of my patients would be bothered by that. So again, to each his own, or to each her own, but this is something that should be considered as a modality to adjust the actual, red lips and to enhance or make these different modifications. And some people, that's all they need. A lot of people want to avoid anything invasive, and this is an option for, I think, a good chunk of people looking at some lip augmentation or enhancement procedures.
I love how natural it looks. And oh my gosh, she like perfectly matched my lip color. Then she moved on to the other side. So this part is known as the first pass.
So look, there's like those little needles from that machine, right? So just keep in mind, that's what's actually introducing this color deeper into the skin.
After that, she applies a numbing gel before doing the second pass. I totally needed that second numbing gel because I could start to feel the needles a little bit more. Still bearable, just more scratchy.
Keep in mind that when we're injecting local anesthesia into the lip, it's going to create some swelling and it's going to start to distort the lip to a degree. And actually, the same thing here, as they're using that machine, they're causing some local trauma that's going to lead to some inflammation in the tissue, and it's going to start to change shape, and there's going to be some areas that are more full than other areas. So it's very important to have those initial markings that you can follow, and you don't want to lose those markings, because as soon as you touch the lip, it's already getting swollen. So you need to kind of stay true to your original markings, because it's very difficult to later make little adjustments while the lip is still swollen, because it's already a distortion of the actual original lip. So that's important to keep in mind for surgery, but also for procedures like this.
As she's tattooing, she's checking all the areas, and if certain parts need a little bit more, she'll do an extra layer there.
And the thing is, you can always come back for more sessions in the future as well. So if the color wasn't perfect, if you want to adjust a little bit more shape, you can always do a little bit more. Now, it's hard to take away, right? As is the case with a lot of different types of cosmetic tattooing, but it is theoretically possible with the use of different lasers. But again, if it's just like to add a little bit more, people can have additional sessions in the future.
Quickly talk about the cost of the lip liner tattoo. They charge 700,000 Korean won. This price also includes a touch-up session, which is usually done 1 to 3 months later, and the results last anywhere from 1 to 3 years, depending on your skin type and also what type of skincare you're using.
Remember, for better or worse, it's not like the results completely go back to the original lip after a few years. You still have some semblance of the cosmetic tattoo even a few years later. It just has sort of faded in coloration by that time.
Once it's healed, the color stays stable and it won't change or fade into any weird tones.
Well, hopefully not, but theoretically it can.
Love to come back for a touch-up session, but I don't think I'll make it back to Korea in the next couple of months. So Belle is going to deepen up my lip liner a little bit and do a more thorough job just to get a better long-lasting result, since she knows I probably won't come back. All right, are you ready for the reveal? Here's what my lips look like right after the session. Wow.
Remember, they're also quite swollen now because of what we talked about. That stimulation of that skin is going to lead to some swelling. So you're just seeing a very full lip, as if she just had lip filler, right? That's why it's always kind of not exactly the most accurate when you see the results of lip filler right after it was done, because they look much more plump than they will even a few days later. So it's the same case here, but obviously this is high quality work when it comes to the lip liner tattoo. But just it's important to remember that it doesn't exactly look like this. Even just even hours later, it might look different. It might look more swollen for a few days after this type of procedure, and then usually 3 to 4 days after the cosmetic tattoo, that swelling is going to start to come down quite a bit.
So juicy. Now there is a little bit of swelling, so the size will go down slightly. But guys, I am obsessed with how they look. It's like my lips, but better.
Again, it just depends on what you're looking for. I think this is a nice change for her. Do I think it's a perfect match of color to her actual lips? No. Is it going to be difficult for someone to tell, whether it's her lip or this type of cosmetic tattooing? Of course it will. Most people have no idea. And then she might wear some makeup anyway, and then it's even harder to tell. So again, this is not for everyone. Just like SMP for the scalp is not for everyone, but it's a great modality that people need to know about so that they can decide if it is maybe right for them.
She told me to avoid hot and spicy food for the next 4 hours. Just 4 hours. I was kind of shocked.
Because the hot and spicy foods are going to potentially lead to a little bit of bleeding. Theoretically, that's possible here. And also more swelling, right? So she's trying to cut down on that for Tina.
Belle also gave me this lip balm to apply throughout the day to keep my lips moisturized.
Interesting. We actually have the jojoba oil in our scar gel, so that's kind of a cool thing.
I'm done with my lip liner tattoo. I'm looking a bit crazy because there is a little bit more swelling, so my lips look extra plump. How good is the color? I love it. All up, it took around 2 hours to do because we were filming, so it was a little bit longer. But yeah, pain-wise, it started off as maybe like a 3 out of 10. And then as she did the layers, it kind of crept up to about a 5, but totally bearable. In the following days, I noticed the color deepening along the lip line. Totally normal and a part of the healing process. I just kept applying the lip balm as instructed. I also noticed that my lips started to peel slightly, but it wasn't anything dramatic.
Remember, the skin got traumatized, right, by this procedure. And that's, the case with any procedure on the face. And so it takes time to heal up from that. The skin is going to get a bit more red. It's going to start to peel potentially, like in her case, but eventually that process improves. And in a week or two, she'll be able to apply her usual makeup routine, and the area takes some time to heal. Even though it's not surgery, it's still a real procedure that's penetrating into the skin. And, even things like infection are possible. You can get viral reactivation, like a herpetic outbreak from this type of procedure, just like you can from filler or from something like a lip lift. And so it's not a completely benign procedure, so it's important to know those risks as well when considering undergoing something like this.
I can feel my lips start to dry up a little bit, but it's not too bad. It just feels a little bit chapped.
See, 5 days out now, that swelling is significantly better. Usually you get that peak around 3 days, and we talk about this in our lip lift recovery video. Same thing with any real procedure on the lips, is that you're going to see a peak around day 3, and then it's going to start to come down from there.
Here's what my lips look like now, fully healed. They look so natural, and it's such a subtle tweak.
Yeah, the color of that tattoo is very similar to her natural lip, so she has a lot to be happy about here. And notice how that right side is still her fuller side, but that's again true to her natural asymmetry. So maybe that's why they wanted to maintain that with the actual cosmetic tattoo.
I only have a little of lip balm on, and this is the natural color. The results look really natural. The only thing that I notice is here where the tattoo lip liner kind of stops. There's a bit of a disconnect if I open my mouth, but not a huge issue because only I can see that.
And again, that's something that can be adjusted with the touch-up procedure. But I think she's had a really nice outcome. Let's see what she says here at the end.
I feel like this is a great alternative if you want fuller looking lips and you don't want to head down the filler direction.
Yeah, if you don't want to head down the filler direction or the lip lift direction, then I think this is a really nice alternative. So I'm glad that Tina made this video. I think it's great to see. It's great to see her happy and a really nice result for her. So that always makes me happy, So thank you, Tina, for sharing your journey. And hopefully the commentary here helped some of you figure out your options. See ya.